Ketamine is a dissociative anesthetic with psychedelic properties that was synthesized at Wayne State University in the 50s. It is a derivative of PCP that was originally used as a battlefield anesthetic in the Vietnam War. It was found to be quite effective. In my career as an emergency room physician, over 20 years or so, I used it almost daily as a sedative for children to perform painful procedures, and it would perform quite well. The patients tolerated it well, and it was short acting, and we never had any issues with it. Over the last 10 years or so, since the early 2000s, psychedelics in general have experienced a renaissance. And we're starting to find their use for treatment of mental illness has come back. Historically in the 50s, psilocybin was considered a miracle drug for mental illness. It was a go-to treatment for alcoholism, for example. And then in the 60s, there was a change. The Timothy Leary's, Ram Dass, got a hold of psychedelics. They began a trial at Harvard University and had some amazing results. And then psychedelics sort of left the academic realm and entered popular view. And things got a little off the rails. Psychedelics have really powerful healing capabilities when used within the right perimeters and within the right boundaries. But what we found in the 60s is when you let everybody just do what they're going to do, well, then strange things happen, and the whole thing got shut down. And you end up with psychedelics being declared a Schedule I drug for a medication that is not addictive, is very well tolerated, people don't overdose from it, and it has profound healing properties. So in the last 10 years ago, this has experienced a renaissance, and people have been revisiting this. And so it was found that psilocybin, for example, in one dose could help patients suffering from terminal illness to suddenly no longer fear death, for example, after one dose. So why aren't we using psilocybin here? Why are we using ketamine as opposed to psilocybin? Well, psilocybin is still technically illegal and has not been FDA approved for treatment of depression or mental illness. Ketamine, however, has been FDA approved. It has a established record of safety, and its chemical properties produce a similar dissociative state to some of the other classic psychedelics. And this is something that we can use within a treatment paradigm for deep healing. It's also been found just in and of itself to ease depression and anxiety. Even without the psychedelic experience, it's been found to be helpful in those areas as well.